All right, everyone, we're continuing now with the clinical effects of diabetes. If I'm going too fast or giving too much detail or not enough detail, leave a comment and I'll see if I could do better in my next set of videos. This is my very first one, so hopefully I could get better as I go, and the lighting and the sound can get better as well. We just spoke about the diabetic foot ulcer and microcirculation and macrocirculation being affected. Now I just want to go ahead and I started with the foot ulcer because that's what everyone knows that happens to diabetics. But I want to talk about now cardiovascular effects, neurological effects, vision effects. Okay, every single cell, and I think I could explain this and wrap it up pretty quick. Every single cell is going to be affected the same way that this foot ulcer here was affected. Okay, this foot was affected in such a way that it became ischemic, like we spoke earlier about in the glycolysis factor. Had a lot of buildup of lactic acidosis, not enough ATP, so the ATP didn't exchange potassium, sodium the way it does, and the pump between sodium and potassium. There's pumps that don't need energy, that they're just there and passively things flow in and out. And there's actually the actual pumps that do need energy. Okay. Now the other ones I don't want to call them pumps. I'm sorry. Let me call them channels. Okay, because a pump means that it needs some type of energy to pump something actively. There are channels for so many minerals and molecules, and then even sodium and potassium have channels all around the cell that allow for potassium and sodium to leak out and leak in passively without the use of ATP. What happens is that they leak out and they leak in to look for equilibrium. ATP doesn't want equilibrium. ATP wants to keep potassium on the inside and sodium on the outside. Okay, this is a constant seesaw effect. If ATP is blocked or diminished, the cell will become more stagnant. There'll be less movement of a lot of these electrolytes in and out, so there'll be less flow. Think about it as a fast car or a fast vehicle driving through a street full of leaves that just fell. The faster that vehicle drives, the faster those leaves, that little wind, that wind that the vehicle is breaking apart as he's driving fast, all the leaves that it passes will be blown out of the way. Okay, so it's a circulatory system. ATP is a circulatory system of the cell. Less ATP, the cell will die. Okay, so what happens is that these cells will die if you don't have enough glucose. Okay, if you don't have enough oxygen and nutrients to produce these ATPs. And this is true for every single cell in the body. Okay, whether you're talking about bone, whether you're talking any cell in the body that has a nucleus and has a mitochondria will die without these nutrients. So in the heart, it's the same example as I gave in the foot. In the heart, you have tissue that necroses, and there you have angina, okay, symptoms where when the heart starts to beat faster, it needs more oxygen and it needs more nutrients because, hey, the heart's beating faster, you're walking up the stairs, so your heart is now beating 100 times a minute, and guess what? There's atherosclerosis buildup, and there's not enough nitric oxide being produced, plus on top of that the heparin isn't exposed as it should be, so this vessel isn't working like it should be. Maybe when you're at rest enough blood can go through it, but now when the cells are working faster, they need more ATP for this pump for the cell to be functioning. It can't because it is blocked, all right, due to the atherosclerosis and arteriosclerosis that has been building up over the years of hyperglycemia. Okay, so that's how it affects the heart, and there's a very distal artery branching off of the LAD, and wherever there's necrosis in the heart, if it ends up landing in an area of electrical conduction right here, this is the from the bundle of His down to the left and the right bundle branch, and you have necrosis right around the tissues that hold one of these bundle branches or Purkinje fibers, and you will see an abnormality on an EKG. Okay, you could also have a heart attack, an MI, due to ischemia in an area where it won't necessarily affect conduction, because maybe it's at the very end, the Purkinje fiber, so the conduction is very, very minute, very minute. You'll see it maybe in the repolarization phase, and even then you might miss it completely. So you can have a heart attack with a pretty normal EKG, but the worst and the more that the heart attack affects your heart, the more effects that you'll see on EKG: bradycardia, shortness of breath, heart's not pumping now because you have that muscle, so you end up getting back up into the lungs. You get cor pulmonale, you get pedal edema, and in a cardiac lecture we'll talk about all those things. So the same thing happens in the retina. Okay, every tissue needs blood and nutrients. So your retina will also become ischemic. It'll end up dying. Okay, your neurovascular, your neural system, all right, your peripheral nerves, and even your central nervous system. Okay, diseases like dementia, all right, from Alzheimer's and Parkinson's and a lot of other diseases can be provoked. Okay, there's no way you could tell me that it is not a provoking factor to have diabetes if it affects your neurons. I mean, it affects everything in the body that needs blood, that needs circulation, will be affected by this. Okay. And your neurons are very sensitive, all right? Let's say there's a peripheral nerve, okay? It could be maybe 2-3 inches long, extending to your fingertips, and you could have some type of neuralgia, okay? So a lot of patients with advanced diabetes and they haven't been controlling it right end up having a lot of nerve damage because this tissue is highly needy for oxygen, okay? Remember, everything you feel, from the wind to someone touching you, to cold, everything you feel, every action that you want your body to do. I mean, these neurons are working overtime, so they're very needy of oxygen. So they become ischemic very fast. So you could definitely affect for you to have some type of a peripheral neuralgia or neuropathy, I'm sorry, before you actually have any cardiac manifestations or even renal manifestations, which I didn't put here, but as you can imagine, like I said, every single cell in your body, every single organ system in your body is affected. You know, the question is, what gets affected first? You know, if your kidneys and heart can last forever and your vision isn't that affected, hey, maybe you could live a long life and not take care of yourself, and you know what, you could put up with some ulcers and you could put up with this. But you might be one of those unlucky ones that, you know, at age 40, you didn't care to take care of your diabetes, and now, you know what, yeah, you have some neuralgia and foot ulcers, but at the same speed that you have neuropathies and foot ulcers, you know what, your heart was getting affected pretty quick too. You can never tell, hey, you're going to have heart disease at 80, or you're going to have heart disease at 30. No, you can't say that. You can't say. You can see the most unhealthiest individual in the street. You could weigh 500 pounds, and you can live to be 90 years old, man, if you don't take care of yourself. But do you really want to risk it, you know? Do you really want to risk it? So this is information that you should always understand, so you could always make your patient understand, because part of the problems in medicine is that patients don't understand. You know, sometimes we lack the time or the knowledge to break it down to them in a simple form, and you know, it gets too complicated for them, and it's hard for them to try to understand all this mumbo jumbo to them. Okay, so this is basically the effects that diabetes has to you on clinical manifestations. This is what foot ulcer, how it's caused, neuropathies. You know, when we do our physical exam, physical diagnosis, is, hey, you know what, you're doing a sharpened dough, and this guy says dough for everything. Now you know that you have fine sensation. His neuropathy is he has neuropathy. You know, can't feel the pinprick. Now let's get into the diagnosis of diabetes. Okay, we know that some symptoms that could happen later on with diabetes, but how do you diagnose diabetes? The first thing is a clinical symptom that leads you to, hey, let me try to see if this individual has diabetes. If anyone says that they have a lot of shortness of, they have a lot of fatigue, maybe they've been urinating frequently in the middle of the night, okay, diuresis, which high hyperglycemia can cause, or if they have excessive thirst, you know, they have excessive hunger, their appetite has been really off lately, you want to make sure you test them for diabetes, because these are all manifestations of diabetes. And if anyone requests, enough people request why these signs and why these symptoms do occur because of diabetes, I can make an additional video for that, but for right now I'm going to leave it at that. So polyuria, polyphagia, and general fatigue, not feeling well, you know, hypertension, check for diabetes. And we're going to get into diagnosing that, hemoglobin A1Cs, blood glucose levels, and how you treat, both with medicine and with diet.